Participating in sports is a fantastic way to stay active, healthy, and happy. It challenges our bodies and minds, builds teamwork, and brings a great sense of accomplishment. However, with any physical activity comes the risk of injury. A sports injury can be anything from a minor muscle strain to a more serious issue, like a ligament tear or a broken bone. These injuries are not just painful, they can force you to stop playing the sport you love. They can interfere with your daily life, making simple tasks difficult. The goal is not to avoid sports, but to learn how to participate in them safely and intelligently. This is where injury prevention becomes incredibly important. Prevention is not about being fearful or avoiding challenges. Instead, it is about being smart and proactive. It means taking deliberate steps to reduce your risk of getting hurt while you train and compete. By understanding your body and following some basic principles, you can significantly lower your chances of spending time on the sidelines. Think of it as part of your training routine, just as important as practicing your skills. A strong, well-prepared athlete is less likely to suffer an injury, which means more time enjoying the game and reaching your full potential. The consequences of ignoring injury prevention can be significant. A minor, untreated ache can easily develop into a chronic problem that plagues you for years. Pushing through pain without understanding its cause is a common mistake that often leads to more severe damage. This can result in a longer, more complicated recovery process. In some cases, a serious injury can even end an athlete's career. Therefore, investing time in prevention is one of the wisest decisions any athlete, from a weekend enthusiast to a professional competitor, can make. It protects your physical health and ensures your long-term participation in sports. In this guide, we will explore the essential elements of staying safe in sports. We will break down the simple yet effective strategies for injury prevention. We will also touch on the science of movement, known as biomechanics, to help you understand how your body works. Finally, we will discuss what happens if an injury does occur, and how modern rehabilitation can help you return to your sport stronger than before. The aim is to empower you with knowledge so you can take control of your athletic journey, making it a long, healthy, and successful one. One of the most fundamental principles of injury prevention is the warm-up. You should never jump straight into intense activity with cold muscles. A proper warm-up gradually increases your heart rate and blood flow to your muscles, making them more pliable and ready for action. This can be as simple as 5 to 10 minutes of light jogging, cycling, or jumping jacks. This initial phase prepares your cardiovascular system for the demands to come. Following this, you should perform dynamic stretches, which involve moving your joints through their full range of motion, like leg swings or arm circles, to prepare them for sport-specific movements. Following a good warm-up, the use of correct technique is paramount. Every sport has specific ways of moving, whether it's swinging a tennis racket, kicking a football, or lifting a weight. These techniques are designed not only for optimal performance, but also for safety. Poor form places unnecessary and uneven stress on your joints, ligaments, and muscles, creating weak points where injuries are likely to occur. It is always a good idea to seek coaching from a qualified professional to learn and master the correct form for your sport. This investment in proper technique is a powerful tool for injury prevention throughout your athletic life. Equally important is the principle of listening to your body and allowing for adequate rest. Your body sends signals when it is tired or stressed, and ignoring these signals is a recipe for disaster. Pain is a clear warning that something is wrong, and pushing through it often makes the underlying issue worse. Rest is not a sign of weakness. It is a critical part of the training cycle. It is during rest periods that your muscles repair themselves and grow stronger. Ensuring you get enough sleep and scheduling regular rest days into your training plan is essential for recovery and sustained performance. Finally, using the correct equipment can make a significant difference in your safety. This includes wearing well-fitting footwear that provides the right support for your sport, using protective gear like helmets, pads, or mouth guards where appropriate, and ensuring any equipment you use is in good condition. For example, running in old, worn-out shoes can lead to foot, ankle, and knee problems. The right gear acts as a protective barrier between your body and the physical forces of the sport, absorbing impact and reducing the risk of injury. Always check your equipment and replace it when it is no longer effective. Biomechanics might sound like a complicated scientific term, but its basic concept is quite simple. It is the study of how your body moves. Think of your body as a machine with a system of levers, your bones, and pulleys, your muscles. Your joints, like your knees, hips, and shoulders, are the hinges that allow for movement. When you run, jump, or throw, your muscles contract to pull on your bones, causing your joints to move in a specific way. Understanding these fundamental movements is the first step toward optimizing your performance and, more importantly, preventing injuries. Good biomechanics means moving efficiently and safely. When your movements are aligned and balanced, the stress of the activity is distributed evenly across your muscles and joints as intended. For example, when you land from a jump, bending your knees and hips correctly helps your large leg muscles absorb the impact. This protects the delicate cartilage and ligaments within your knee joint. If you land with stiff, straight legs, the force travels directly into your joints, which dramatically increases the risk of an injury like an anterior cruciate ligament, or ACL, tear. Correct movement patterns are your body's natural defense against harm. Poor biomechanics, on the other hand, is a leading cause of sports injuries. This often happens due to muscle imbalances, where some muscles are too tight and others are too weak. For instance, weak gluteal or buttock muscles can cause your knees to collapse inward when you run or squat, a pattern known as knee valgus. This faulty alignment places enormous strain on the inside of the knee and can lead to conditions like patellofemoral pain syndrome. Identifying and correcting these poor movement habits through specific exercises is a core part of any effective injury prevention program. You can improve your biomechanics by focusing on a few key areas. Strength training is crucial for building a strong, stable foundation, ensuring your muscles are capable of handling the demands of your sport. Flexibility and mobility work, such as stretching and foam rolling, helps ensure your joints can move through their full intended range of motion without restriction. Finally, practicing balance and proprioception, your body's awareness of its position in space, helps you react quickly and maintain control, preventing falls and awkward landings. Working on these elements helps your body move as it was designed to. Despite our best efforts, injuries can still happen. When they do, it is crucial to manage them correctly to ensure a full and safe recovery. This is where physiotherapy, also known as physical therapy, plays a vital role. A physiotherapist is a healthcare professional trained in diagnosing and treating injuries related to muscles, bones, and joints. Their first step is to conduct a thorough assessment to understand the exact nature and severity of your injury. This allows them to create a personalized rehabilitation plan, tailored specifically to your needs and goals, ensuring you get the right treatment from day one. The initial phase of rehabilitation typically focuses on managing pain and swelling and protecting the injured area from further damage. This might involve techniques like ice application, compression, and gentle pain-free movements to maintain some mobility. A physiotherapist will guide you on what activities to avoid and how to modify your daily routine to allow the healing process to begin. This early intervention is critical because it sets the stage for a successful recovery. Ignoring an injury or returning to activity too soon can delay healing and potentially turn an acute problem into a chronic one. As the healing progresses, the focus of physiotherapy shifts toward restoring function. This involves a carefully structured program of exercises designed to rebuild strength, flexibility, and endurance in the injured area and the surrounding muscles. For example, after an ankle sprain, your rehabilitation plan would include exercises to strengthen the calf and shin muscles, improve the ankle's range of motion, and retrain your balance. Your physiotherapist will closely monitor your progress, gradually increasing the intensity and complexity of the exercises as you get stronger, ensuring the tissues are not overloaded before they are ready. The final stage of rehabilitation is preparing you for a safe return to your sport. This is about more than just being pain-free. It is about ensuring your body is strong and resilient enough to handle the specific demands of your activity. This phase often includes sport-specific drills, such as practicing cutting and pivoting for a football player, or throwing motions for a baseball player. The physiotherapist will help you regain your confidence and correct any faulty movement patterns that may have contributed to the initial injury. By completing a full rehabilitation program, you not only heal but also reduce your risk of re-injury, allowing you to return to the game with strength and confidence.